In this video, we're going to learn how to calculate risk ratio and how to interpret risk ratio. So to start off, we want to know our formula, which is the EER divided by the CER. So this stands for the experimental event rate divided by the control event rate. And so the tricky thing about risk ratio is you are going to interpret it differently depending on the context of your risk ratio. So for example, the best way to approach a risk ratio is to think of your PICO question and to think about what the outcome of interest is and whether or not that outcome is a positive outcome, if it's something we want, or something we don't want. So an important question you're going to want to ask yourself before you correctly interpret a risk ratio is, do I want a higher event rate or a lower event rate? In this case, is it better to have a greater number of events, or is it better to have a lower number of events? So let's go through this simple example to highlight what I mean by that. So let's say you have two groups. You have an experimental group and you have a comparison group. And just for simplicity's sake, you only have 10 patients in each group. So as you can see, in group A, we have 10 patients, and in group B, we have 10 patients as well. And now let's think of a PICO question. Let's say your P was obese adults, your I was liraglutide, which is a GLP-1 agonist, your C was no liraglutide, and your O was weight. Now let's specifically say that our outcome of interest was the percentage of patients who achieve a loss of at least 5% of their body weight. So either the patients lost greater than or equal to 5% of their body weight, or they did not. So it's almost like a yes or no question. Did the patient achieve at least a 5% reduction in their body weight? If yes, then they are considered to have the event. If no, then the patient is not considered to have the event. So again, if the patients achieved at least 5% of body weight, a reduction of at least 5% of their body weight, then we would say that that patient experienced the event. But if a patient, let's say, only lost 1% or 2% of their body weight, then they don't meet that cutoff. So we'll say the patient did not experience the event. So in this case, our event is a good thing. So we actually want our event rate to be high. So this is unusual, which is why I chose this example. Usually when you're looking at an event rate, it's an event of something negative, like the event rate for heart attack or stroke, or the event rate of death, mortality. But in this case, our event is something that we actually want. We want patients, ideally, to lose more than 5% of their body weight in this specific example with this specific PICO question. So in this case, our event is a good thing. So we want a higher event rate. So keep that in mind so that when we get to the interpretation part of things, this is easier to understand. All right, so let's see. Let's say we conducted our experiment, and in our experimental group, we saw that 6 out of 10 patients achieved the event of losing at least 5% of their body weight. And those were the patients that were receiving liraglutide, because that was our intervention. But let's say our control group, here, they were not receiving liraglutide. So actually only 3 out of the 10 patients lost 5% of their body weight. So how would we calculate our risk ratio in this case? So our risk ratio is simply going to be our experimental event rate, which is 6 out of 10, divided by our comparison event rate, which is 3 out of 10. And so that's basically 6 divided by 3, so we get a risk ratio of 2.